This video demonstrates technique for nasolacrimal duct probing and intubation under sedation. We dilate the inferior puncta with a punctal dilator. A Rittling introducer is placed through the inferior puncta and guided along the canaliculus to a bony stop. The introducer is then rotated to a coronal or vertical position and guided along the lacrimal sac through the nasolacrimal duct and valve of Hassner to be positioned under the inferior turbinate. We verify that the introducer has reached the correct position and it is removed. The puncta is redilated. We then use the Lacrijet 30 nasolacrimal duct stent. The Lacrijet is guided carefully through the nasolacrimal duct. We gently remove the Lacrijet inserter. We seat the stent's collarette into the puncta using a disposable punctal plug inserter. The same procedure was then performed on the fellow eye. Thank you for watching.